When we talk about ALS, amyotrophic lateral sclerosis, our minds usually jump to the search for a cure or the incredible courage of patients. But in the day-to-day reality of that fight, there's a kind of unsung hero, a central figure who really makes everything else work. Let's dive into who that is. We're talking about the ALS nurse.
And look, their impact isn't just some feel-good idea. We're talking hard numbers here. 30%. That's how much hospitalizations can be reduced for ALS patients when a nurse is leading the charge on symptom management. That one number tells you so much about the power of smart, proactive care.
And that makes sense, right? Because in a fight this complex, against a disease that just keeps coming, success isn't just about having a bunch of different experts. It's about coordination. And at the very heart of that coordination, there's one person making sure all the pieces of the puzzle actually fit together.
So, where does this all happen? It's in these places called multidisciplinary clinics, or MDCs. Now, this team approach, it's the absolute gold standard for ALS care. And for a really good reason. We have the data. Studies show we can actually extend survival and dramatically improve a person's quality of life.
So what's the secret sauce here? It's not enough to just have a neurologist, a physical therapist, and a dietitian all under one roof. The real magic, the thing that makes it all click, comes from that one person who acts as the central hub, the constant point of contact. Yep, the nurse. Okay, so to really get this, let's break down what the nurse actually does. And their first job is kind of like being a detective. ALS is a progressive disease, which means tracking its changes with pinpoint accuracy is everything. And the nurse, they're on the front lines, gathering clues at every single visit.
One of their main detective tools is something called the ALS Functional Rating Scale. You can think of it like a functional report card. As you can see, it checks on key functions, everything from speaking to breathing. That total score gives a snapshot of where the disease is. But here's the key. That score isn't just a number on a page. It's a signal, a flashing light that tells the nurse exactly which specialist needs to step in and when.
They're also watching some really critical data points, and a huge one is breathing. This thing called FVC, or forced vital capacity, it's basically a measure of lung strength. So when that nurse sees a patient's FVC dip below 80%, bam, that's an early warning flare going up. It's often the very first sign of respiratory muscle weakness, and it triggers a much deeper look from the team.
Okay, another huge trigger point? Nutrition. Now, a 10% loss of body weight might not sound like a total disaster to most of us, but to an ALS nurse, it's a 5-alarm fire. It tells them that swallowing is probably getting tough and unsafe, and it's time to bring in the dietitians and speech therapists like right now. And what happens if that breathing number, that FVC, drops even further, below 50%? Well, that's a massive turning point. The nurse knows that number means it's time to start having a really important proactive talk about breathing support, like a BiPAP machine. And that's the whole point of this detective work, right? It's all about acting before a crisis can even happen.
So, this whole idea of being proactive brings us to the nurse's next big role, the strategist. They're not just reacting to what's happening today, they are always thinking 3, 4, 5 steps down the road, building a plan to handle this incredibly complex web of symptoms. And this is a perfect example of that strategy in action. Take a look at how they handle something like introducing a feeding tube. It's not just one thing. They're monitoring weight, they're educating the family on all the pros and cons, and this is crucial, they're pushing to get that tube placed before the patient's breathing gets too weak to do the procedure safely. And then, they train the family on how to use it all. I mean, it's just a masterclass in forward thinking. And believe me, their toolkit is huge. We're talking about everything from managing breathing machines and feeding tubes to doing fall assessments, coordinating communication devices, and helping manage medications for things like pain and spasticity. They pretty much have to be an expert in, well, everything. And all this expertise is exactly why their third role is so incredibly important. They're the conductor. You've got this whole orchestra of amazing specialists, right? But someone has to hold the baton. Someone has to make sure they're all playing the same music at the same time. That's the nurse.
And this conducting job, it happens everywhere. Yeah, inside the clinic, they're the ones who juggle all those specialist appointments into a single, exhausting, but efficient day for the patient. But their work doesn't stop at the clinic doors. Outside, they're the ones arranging home health care, fighting with insurance companies for approvals, and chasing down equipment suppliers. They are literally the glue holding it all together.
And that brings us to their final role. And honestly, it might be the most important one of all.
The nurse is the anchor. In the absolute emotional hurricane that is an ALS diagnosis, the nurse is that point of stability, that source of guidance, for the patient and for their entire family.
Seriously, just stop and think about that for a second. How do you prepare a family for something that is, by its very nature, unpreparable? How do you hand them the tools and the confidence to walk a path that's going to change every single thing about their lives? It's a monumental task, and it lands right on the nurse's shoulders.
The answer is, they do it through empowerment. They take all that confusing medical jargon and translate it into plain English. They're not just telling you about the equipment, they're showing you how to work it. They're teaching strategies to save energy. And they're connecting you with other families, so you never, ever feel like you're alone in this.
And a really critical piece of this empowerment is something called advanced care planning. At its core, this is all about making sure the patient's voice is the loudest one in the room. The nurse is the one who has to start these tough but absolutely essential conversations early on, making sure that when the big decisions come up about things like ventilators, those decisions are guided by what the patient actually wants.
And that right there, that focus on dignity, on autonomy, that's what can completely change the experience of living with ALS. They become the translator, the advocate, and the guardian of the patient's personal wishes all the way through.
So you bring it all together, right? The detective, the strategist, the conductor, the anchor, and you start to see the whole picture. The nurse isn't just on the team, they are the linchpin, that one single point that holds every other piece in place, weaving together all that clinical skill with just a profound sense of compassion to create a real lifeline.
And it all kind of leaves you with this bigger question, doesn't it? In our modern world of medicine, with all its amazing technology and hyper-specialization, what's the true value of a simple, consistent human connection? Someone who knows you, who guides you. Well, if you look at the role of the ALS nurse, the answer seems pretty clear. It might just be the most powerful treatment we have of all.